Hey everyone, welcome back to Prime Time. I'm stoked to talk to you guys again today. My name is Dr. Chad Kuhns. I'm the founder and owner of Prime Movement as well as Prime Time. And last time we covered part one of the Terrific Trio where we talked about cupping primarily. And we kind of really delved into that. We talked about how it's a little bit more of you need to be an artist with the paintbrush and to really utilize it appropriately, not cupping is all created equal. That's kind of what we're talking about today, but we're going to talk about dry needling. And there's certainly been a buzz in the air, and probably in the last few years, and rightfully so, just because therapists and practitioners are starting to get their hands on it. It's kind of this hot fad, like let's try this out, let's see if this works for me. So I just wanted to give you my perspective on and how I've been using it since I've been using it for the past couple years. And to a fault, I think sometimes people feel like it's a miracle drug, it's a miracle pill. Wouldn't that be nice if you could just hop in and have a miracle pill and then everything's good? It certainly feels nice to think that way, and certainly at times it can feel profound in terms of how great it can work. But I just want to kind of give us the whole picture here rather than just singing and praising and bending our knees to it and holding our arms overhead to it. But dry needling actually kind of started not quite as rich of a history compared to cupping, right? Cupping, we're talking about 1500 BC. Needling, really kind of what they call wet needling, where they injected with an analgesic of sort or saline or whatever it may be, that actually started in the 1940s when they started to look into fascial trigger points. That's really the first time that, from what I could tell, is when we started to really get into trigger points. And it wasn't until like the early 1980s, I think one number I saw was 1979, when they started to do these injections into intramuscular myofascial trigger points. And I think it was by accident, they actually forgot to put the analgesic in, yet they still had a great result. That was a pretty aha moment, I believe, to the health world there. And I bet there are some pretty stunned faces like, hey, did you get the analgesic in there, Fred? Oh crap, no I didn't. Hey, I still feel better. Holy cow, that's nuts. I bet it was something like that. So since then, where we're starting to notice the power of the myofascial system and how it can refer pain into certain areas, you bet there's been a buzz about it. So then it's going to be, well, what can we do to help decrease these trigger points, whether they're active and they are creating pain right now or even active? And so the awareness to this whole field has just gotten so much bigger. One of the main reasons that we've continued to discover the importance of the myofascial system is to really help try to prevent surgeries from pathoanatomical reasons. So check this out. So the subscap, that's just an example. It's one of the four rotator cuff muscles, and it sits underneath the shoulder blade. When that muscle gets really tight and hypertonic, it can actually recreate pain to the back side of your shoulder. So prior to all this, you might go into the MRI or X-ray, you got pain in the back of your shoulder, no one can figure it out. MRI shows arthritis in the back side of your shoulder, shows a small cyst, and it shows that your labrum is irritated. What do you think they're gonna do? I mean, they're probably gonna give you a corticosteroid shot, and then they're gonna say, well, obviously you've got some forms of impairments on the X-ray and MRI. You need to get in for surgery to get this cleaned out. The problem is that we've kind of noticed, and I've seen this personally, that person might go on to have that surgery. They're regaining full range of motion. They're doing their physical therapy and working through the exercises. And 12 weeks later, they're like, guys, I still have my pain. Like, what do you mean? The same pain that I went in for surgery, it's still there. Crap. And in that case, in the example, that subscapularis is actually recreating that pain in the back of the shoulder. So you could see how important it is that we investigate what your myofascial system looks like. And that's really been the direction I've headed in terms of my clinical career, to be very heavy in terms of what the myofascial system, the musculoskeletal system is doing, because there seems to be a lot of pain that's evading traditional healthcare that needs to be addressed. So just to kind of get into it, dry needling is wonderful in a lot of different ways. I tend to use it to help initially decrease sensitivity. So let's just say I'm working on the pack and I'm barely putting my hands on you and you're kind of jumping around and you go, oh my God, that's so sensitive. I might actually start with like a small little needle and just kind of working into that a little bit. And I might just do one. I might literally just do one, depending how sensitive you are, where I just go into the muscle for 10 to 30 seconds, and then I'm done. I will just introduce the concept of what dry needling can feel like to your body, to your nervous system, to try to calm it down. And really, I kind of use it in that way as a form of desensitization, and probably at part just getting into your neuromuscular system. So as some of you might remember, you've got the parasympathetic system and then the sympathetic system. Sympathetic system is going to be more of your fight or flight, right? The bear's coming at you, your sympathetic system's up, and you're running like hell. That's kind of what happens when you've been in pain for a long time. Your adrenal glands keep running, your norepinephrines and your adrenaline's constantly elevated. So if you're constantly elevated, it only makes sense if I touch that pack and you jump, that's because your body's in fear, and it's been in fear, and it's been in that sympathetic system, fight or flight, for a little while now. So if I interject a strong stimulus like a needle into you, you bet you're gonna jump up through the roof, right? But as we keep doing that 2, 3, 4, 5 times in different sessions, you're gonna be able to tolerate that much better. You're gonna be able to tolerate that weird sensation, and it is a weird sensation. Just to kind of take a quick pivot on that, the sensations I've seen are all over. People can feel it, like if I'm on the chest, let's just keep that. They might feel it go down to their arm. You might kind of feel like a woof, like kind of a zinger, like holy cow. They might not even notice it at all for a little bit, and then they feel the muscle jump. If the muscle jumps, that's actually what we're looking for. An involuntary contraction is what we're looking for. And I kind of like to describe it to my clients. Imagine that your body's just got all this harnessed up neuromuscular system bound up in that muscle. Kind of like it's inside a balloon. But if I go in there with the needle and pop that balloon, all of a sudden you've got this huge, quick cascade of the neuromuscular system leaving that balloon, and it kind of supercharges that muscle, and then you get that muscle to jump. And most often, soreness will follow that, and then they'll get some relief later on because we hit a spot where it's kind of bunched up. So kind of just going back where we started, it can be great for the sensitivity, it can be great for the neuromuscular system, and I really like it to facilitate muscles by turning them on or off. So we'll stick to the pec because it's easy there. The pec tends to be a pretty dominant muscle, an internal rotator. And sometimes it can kind of over-dominate the rotator cuff. Specifically, it's war with the subscapularis, because both of them are kind of competing for internal rotation. Yet the subscap does a great job at stabilizing the shoulder. The pec does a horrible job at doing that, and it's just got this huge poor effect. It'll pull your shoulders forward, so if you got rounded shoulders, chances are your pec's quite dominant at that. So in that game, I want to facilitate the subscap by turning it on. So that would actually be a cool case to go into the subscap and dry needle that. And then with the pec, I would want to do that to really turn it off. And in that way, I want to help kind of reframe that system in the shoulder, that I'm facilitating a muscle on that I want, and I'm kind of turning the muscle off. And I think that's kind of a great way to look at it. So how do we actually go about it, and how is it similar to acupuncture or not? So we tend to use the same needles. There are a lot of different forms of acupuncture out there, so that's a little unfair for me to say. And there's actually a lot of different forms of dry needling. But generally speaking, acupuncture, they would do it for a different intent. They might do it for your energy, for your chi, for your meridian lines, for cell vibration, and they go in very superficially. It might be just generalized trigger points, not necessarily shoulder specific. We'll keep hammering away at that. And so they might do it all over your body and then just kind of leave you there for 20, 30 minutes. Again, that's very generalizable for you acupuncturists out there. If I've offended you, let me know, but I'm just trying to give people a generalized idea about it. Now, with the form of dry needling I use, I tend to go after it between anywhere from 10 to 15 seconds, where I interject the needle. I tend to have a depth that can get to the rich, deep parts of the muscle belly or tendon. So it's not necessarily a short one all the time. It has to be relative to the muscles that you're going into it. But I will go in and out, kind of pistoning it in and out, in and out, in and out, trying to search and seek and find the tightest spot, and arguably the most sensitive spot. That's of course if it's more of an active trigger point in the acute phases of rehab. If we're doing more like ongoing care and recovery, I'll go deeper even into spots that aren't necessarily tender, but where I can feel like a tightness to it. So I'll go in and out, and that process will last up to, like I said, 2 minutes or so, and I'll keep going as long as that muscle keeps twitching. Because if that muscle keeps twitching, I know that I'm kind of allowing the nervous system to get what it needs out of there, and I'm kind of flushing that system out from a neuromuscular perspective. Once we've done that, I'll stop and I'll take it out. I like to wear gloves on this particular type of style. And then afterwards, I'll just have someone kind of move it around and see how they feel. I know for me, when the people do it to me, I tend to respond very sore. I might be like, oof, I might have a hard time kind of moving it. There's a small percentage of people, like 10 to 20%, I would say, that feel wonderful after moving it, and they have immediate improvement in the range of motion. And that's kind of the fun part. But generalized, I would say with dry needling, I wouldn't expect a result right away. You might be more so sore, kind of covering it up. As you do more repetitions throughout the day, I think then you'll start to feel that improvement. But I would say a smaller percentage than not feel that immediate, like, holy cow, whoa moment, and they can feel a lot better, at least with the style that I do it. But usually the process here with dry needling is that it does take a few days, in my experience, before you can really start to receive the benefits of it. But again, that's my style. I will continue to work around the muscle, but with dry needling, I'm gonna work around the area that you have pain. And I tend to not do both sides unless I kind of get clearance from with you, just because, again, of the soreness. There's some types of dry needling where they'll actually hook e-stim into it. There's different types of practitioners, different models of dry needling. So if I were you and you're receiving dry needling care, just feel free to ask your healthcare practitioner, hey, where did you get, certified? Who is your practitioner through? What's your paradigm of thought? Because there are just some different thoughts out there, and you just never quite know nowadays who's actually doing it, who's doing it the right way. There are some precautions like the lung field. If you're doing it around the trunk, that you want to be careful, that the practitioner should know what they're doing. So that's why you just want to double check. You don't want to cause spontaneous pneumothorax. That would not be good. So yeah, don't worry about that. But you should talk to your client or your practitioner and make sure they know what they're doing. And then the practitioner has to be careful about the nerves and the arterial system as well as the venous system. You try not to hit those. They do happen from time to time. It may leave some bruising. So again, that's just where you want to have the conversation with them. Following up dry needling, you're welcome to do ice or heat. I definitely advocate that you continue to move it throughout the day. If you just hold your arm there because I needled you throughout the full day and you sleep on it, you don't move it much, it's going to be really, really sore. So I encourage active movement. I want you to keep moving it throughout the full day or the next 24 to 48 hours. I tend to like heat more than ice just because you're working on muscles. Muscles tend to get kind of tighter. You want some more blood flow in there. You want some vasodilation. You want some relaxation. So heat tends to do a nice job just to kind of get into that and start opening it up to loosen up. And that can be nice for some recovery. And I really think too, just to be really successful, it really all starts with the setup. You really need to know that the client, that yourself feels comfortable. You know what to expect. You guys are on the same page. You shouldn't just be having someone jump right in there and just going without your consent. There'll be times as you start to get into it that you're gonna be like, whoa, slow down. And that person working with you needs to be respectful of that. That's why when I get going, I say, are you ready? Yes, good. And we start going into it. How are you doing? I found a really sensitive, tight spot. Are you okay if I keep going? All right. And they're like, yeah, go ahead. And that's when I go into it. We'll see the muscle bounce and twitch a few times. And they say, holy cow, it might hurt so good. Keep going. I pull it out. I keep some compression on that area just to keep them a little more comfortable transiently after I come out of there. And I let it rest for about 30 seconds to a couple minutes. And then I might have that conversation with you. How do you feel about going into that again? Because I thought that was very therapeutic. And I bet if we did that one or two more times, that you'll get even more benefit out of that. So it should look and feel something like that to have that conversation with it. And you should be really, really comfortable before you even start with the dry needling. Because if you're not, I can guarantee you're going to be tensing up. that's not going to have a good response. It'll probably hurt more than it needs to. So those are just some fine points that I've noticed in my kind of dry needling career, I guess I can say, that have helped people get the best response. Whew, that was a lot of stuff, guys. That was part 2, where we really delved into what dry needling is all about, what it looks like, what it feels like. It is an art, much more of an art than you may anticipate, and not all dry needling is created equal, just like cupping. There are a few different paradigms and schools of thought. I think you should know that, and I think you should really kind of question your practitioner as to what they're doing and why, and really be investigative in that way. And no, it's not a miracle drug or miracle cure, but I think working through it and having different practitioners kind of give it a try in you, and you might find that one person does it better than the other, and chances are they'll probably help you receive the better care. Next time, we're going to really delve into hands-on care, because I think a lot of people have no idea what really good hands-on care can even look or feel like anymore. When I say that, most people think about most people think about massage, and so we're going to delve into that next time, because I think that's a whole other landscape most people aren't familiar with really good therapeutic care. That is it. I am tired. It was a great day, and we will see you next time for Prime Time. Thanks, everybody.